Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Welcome. This is Health Matters. I'm Khawa Solomon. Sit back and relax as we talk to you about blood donation, blood transfusion. There is a South African National Blood Transfusion, SANBS, as well as the Western Cape, Western Province Blood Transfusion Organization that takes care of these goodies. So we're talking red and we're keeping the theme to blood. If you have ever thought of becoming a donor, please do that now. There are various organizations, communities that are starting their own blood drive, as they call it. Start your own blood drive in your community, at your church, at your mosques, at your community. I don't know, wherever you guys gather, make a focal point and get those organizations, the Western Province Blood Transfusion, as well as SANBS, and give them a call and get the blood drive going. Your donation may just save a life. So before we go any further, let's have a look at our South Africa's COVID-19 stats currently. So to unpack some of the information, and if you had no idea what blood transfusion is all about, let's now talk to the communications specialist at the SANBS, Kensani Mahlongo. Hi, Kensani, how are you doing? Thank you so much for joining us.
I'm very well, thank you. How are you?
Great. I am a happy blood donor. Unfortunately, I can't do that at the moment because of my circumstance, 6 months pregnant and all. But I love how they bug you and they remind you about your donation. Tell us about the SANBS.
So the South African National Blood Service is a blood service, we collect and provide the blood to hospitals for blood transfusion, so we operate in the whole of the country except for the Western Cape, which has their own blood transfusion service. So really everything in between, from collecting the blood, testing it, making sure it's safe enough to transfuse to the patient, that is where we fit into the picture.
Is there a current blood crisis in South Africa, and what is the SANBS facing right now?
So right now we are struggling with finding venues to collect blood. And I like that you mentioned that communities must come together and really rally around finding spaces where they can host the blood service, so that we can come through and collect. So following the lifting of the lockdown measures, we found ourselves pretty much restricted in where we could go and donate blood, so we couldn't go to schools, universities and corporates. Understandably so. So our blood stocks then declined quite significantly because that's where the bulk of our collections come from. And we're now reaching out to really communities, organizations, churches, mosques, everyone who can host us to really please set up a blood drive.
This shortage of venues, what does this now mean? As we can understand, the blood donations have now been limited. What about the patients? What is this doing to them in South Africa who needs the blood?
Yes, this means we're severely under pressure, so we do have fixed donor centers across the country, and we do have people who do go to the fixed donor centers as well to donate blood. But we do find that if we do mobile blood drives and you bring the service to the people, they rely on that service instead of having to travel further. We have to be cognizant of the fact that we have different demographics who donate blood to us. So if we can't reach our donors, our regular donors who can't come to fixed donor centers, it does put us under pressure. And as a result, what happens is that we are sometimes, if our stocks do drop quite significantly, we'll have to implement cutbacks, So these are rationing measures which will limit how much blood we can give to patients whenever they need it, which could be quite detrimental to the health of certain people. And I think it's important to understand that the recipients of blood are not just people in hospital. They are chronic patients who really need transfusions on a weekly, monthly, annual basis. So this does affect people's ability to live normal lives.
To elaborate that group, who are those individuals, those patients that actually needs blood on a daily, monthly basis?
So this could be a variety of people. There are people with bleeding disorders, they would need transfusions, anemic people, those types of groups of people, they would need the blood.
Okay. How has COVID-19 pandemic affected the SANBS?
As I said, we are rather under pressure now in terms of the blood that we are able to collect. And coming into the holidays, we expect that a majority of the people who are regular donors are going to maybe take vacation, which means they won't be able to come and give blood as they regularly would have throughout the year. Fortunately, at the beginning of COVID-19, even with the cancellation of a number of our blood drives, we were able to stay sort of steady. Everyone was at home. They were able to visit their mobile blood drives and their fixed donor centers. But as we opened up, as I said, we did start to suffer quite significantly. So at the moment, we're just at a balancing act now. We're just calling for blood donations consistently, calling for new donors and our regular donors to please come through and donate.
So what if people are asking with regards to donating blood, them being regular donors or new donors, is it safe to donate blood during during this pandemic?
Oh, definitely. I think we've proven that we were able to keep our donor centers incident-free, throughout the lockdown period, the highest stages, and now even with more movement, we're screening everyone who comes into our donor centers, including our staff, which is twice a day. So we are really being vigilant on that. We clean all surfaces before and after use. Social distancing is in place, and before anyone enters the donor center, we do screen everyone. So I think it's very important to us that we keep our donor centers safe. And even prior to the COVID-19 pandemic, infection prevention control measures have always been in place at the SANBS. So we're not worried about that.
How did the SANBS manage with the blood supply during the pandemic and the harsher lockdown period earlier this year?
So we did suffer initially cancellations of blood drives, and we were under pressure for a good month. But thereafter, we were able to stabilize because our donors were presenting to their fixed donor centers to donate blood. So we were able to keep our blood stocks above the 5 days that is needed. Thereafter, we did dip quite a bit. I think the lowest we've been at was about 2.8 days, and we need 5 days' cover to be stable and safe to be able to supply to the entire country. So initially it was okay, but now we are struggling.
So I believe there is a specific need for a certain type of blood group, the O group. Tell us about that.
So the O blood group is the universal donors, and we call to O blood group donors to come through and donate, So if we are able to amass a significant amount of that blood, we are able to cater to everyone in South Africa, specifically O negative blood. But we are calling everyone really to please donate. It doesn't matter what blood group you are, the more blood we get, the better it is for everyone.
We know that during the festive season and hoping that people are listening to the rules and regulations that the president is saying, not to go holidaying too much. But yes, the traffic can be heightened during the festive season. There's more accidents and there has been an increased need for blood supply. Is this expected once again for this holiday season? And what happens? What are the risks you guys are facing with the current situation of not getting enough blood?
Exactly. We are on high alert at the moment. We are expecting that people will be traveling, and with the blood stocks already being under pressure, that already makes us a bit nervous. But, we are working around the clock. Our communities are helping us. We are finding donors are responding to our calls for donation. So while we do anticipate a lot of pressure, we are still working around the clock to make sure that we keep the blood stocks stable.
Let's talk about those drives and how people, individuals or organizations, leaders in the community can get involved. How can they do this? Even our children, if they're watching us currently, to get them all hyped up to start donating. I know they're not probably part of the group that can, but to get that conversation talking even at the school as they're closing and gathering during the school holidays. How can they still connect with their friends to, create a blood drive?
So the children can help. So if you're 16 and above, you're already qualifying to be a blood donor. So we are calling to those, the youth, to actually really get involved. And we do have a number of schools where students are blood controllers. So they are the ones who rally up everyone and really push for blood drives to take place. But I think an interesting way we can do it is that everyone brings a buddy to go donate, Sometimes you'll find that someone cannot donate blood because maybe their hemoglobin is low on that day and they can't donate. So if I go and donate blood today and I bring 3 buddies, at least one of us is going to be able to donate, So maybe let's adopt the buddy system during the holidays. You're all going to be around each other. So maintain social distancing. I have to say that, just be safe. And if you are coming in, just bring someone with you. I think the more people, the merrier.
What does blood donation entail? For the first time goers, I know I dragged my husband with and my daughter. She ended up, oh no, I'm not doing this again. I had to, literally lick a thumbs to come back. So yeah, tell us, what does that entail, and explain to them how safe it can be and fun.
Blood donation is a very simple process. It'll take just 15 minutes of your day. So you come through to a blood drive or a donation center. We screen you, you enter, you fill in a very brief questionnaire, which is very thorough as well. So it'll screen you to make sure you're healthy enough, You go in for a mini medical, we check your blood pressure, your iron levels for the day. If your weight is also adequate for donation, thereafter you just go to a bed, you lay down. We take a couple of vials of blood just to, for the testing purposes. Then we'll also extract about 480 mils of your blood. It's just one pinch of a needle, really. It is painless. It's just like one pinch, and then it's over as quickly as it started. You get a box of juice and some cookies just to replenish your iron, and then you're off.
Can people find you to do that, to do exactly that? Where can people find you?
So we have blood fixed donation centers across the country, as I said. If you don't know where they are in your area, you can visit our website, sanbs.org.za. We list all those donor centers that are operating in your area. And if we don't have fixed donor centers, then we also have mobile blood drives that are taking place often. So while we don't list those all on our website, you can call our call center on 0800 11 9031. There, they'll tell you exactly where you can find a donor center or a blood drive in your area, and you're good to go.
Great stuff. Kensani, Communication Specialist for the SANBS, thank you so much for your time, and hope you've definitely effectively projected that message of people starting and initiating blood drives and coming out. Please visit the SANBS and their social pages to find out where they will be next. All the best till we chat again. Be safe to you and your family, Kensani. Goodbye for now.
Thank you so much.
It's
Bye.
a pleasure. We'll chat more on blood transfusion and donation just after this. Stay with us. Welcome back. As always, in each show of Health Matters, we interview a COVID-19 survivor. We have seen now the second wave hitting us here in South Africa, and we need to take the necessary precautions and learn from what our survivors have experienced. We speak to 45-year-old Cape Townian Ridwan Hassim. Assalamu alaikum to you, Ridwan.
Alaikum salam. How are you?
Good, alhamdulillah. All things well in the beautiful mother city?
All things well, just waiting on the long awaited 6 weeks of school holidays now. So we're not quite sure what we're going to do with the kids.
Yes, a decision we often boggle with because we're going to keep it safe this time around. So, inshallah, I'm sure you'll come up with, and they can come up with something at least.
Yeah, I think it's going to be different.
Yeah. No, very different. 2020 is a year to remember. Ridwan, you, father, husband, you find yourself in the corporate industry as well, and you were hit with COVID-19 in late June. Tell us about your experience and anything that did stand out for you.
Yeah, I think let me first say Assalamu alaikum to all the viewers and all the aunties from Cape Town that's watching the show. I think, life before COVID was like a normal Cape Town Muslim family. We came out of Ramadan with all the blessings. We managed to, make all our Tarawih Salahs together as a family, and our three sons were leading some of those Salahs. And then COVID hit us. It actually started with my sister and her husband, and then our eldest son got tested positive. And then I started showing the signs, and I was then informed by our local GP, Dr. Aziza Baudin, and her daughter, Dr. Leila Bigo, that I need to get tested ASAP. Now, I think the reality kicked in, I think, at that point in time, because, here's a virus coming all the way from China, finding its way into our home. We always think that these things will never happen to us. And here, all of a sudden, everything that we thought wouldn't happen actually happened. I think the most important thing during that time was the support structure that was in place, and it was provided by my wife, our children, our family, our neighbors, friends, colleagues, strangers, the community at large. The symptoms, if I can speak about that, the symptoms in itself, it varied between myself and our eldest son. I remember one evening, I couldn't sleep because of all the body aches that we had. And I tried every position to basically just find some rest, to get some sleep, and I couldn't find the correct position. Laying on my back, on my side, even trying to fall asleep on a work chair that I managed to find home. The only position that really helped that night was when I actually went into a sujood position. Literally, I don't know why and how it happened, but this is when everybody was asleep. Very few people know about this. And it brought some relief that evening, to the point where I think I fell asleep while making sujood. And then in some cases, difficulty breathing, just reciting salawat, it helped a lot. Some of the medicines that I took, look, there is no cure as we know it, So the only real thing I could do was to treat the symptoms, and we did that by taking vitamin C and cold medicines and ginger tea, and my mom-in-law would make some soup for my sisters. One thing that was a tremendous help though was black seed oil. So the black seed oil I took, I remember distinctly, because your taste and smell goes when you're COVID positive. So as my sense of smell and taste came back, the bitterness of the black seed oil was sort of an indication to me that I was getting better. I remember that, and some exercise as well. Your daily intake of vitamin D out in the sun. I think that was very important as well, just to have that balance. But I think life with COVID, anybody should ask me where and how we actually got it, we have absolutely no idea. We've stopped asking the question, and we've just lived with it. And I think the one thing that we are reminded of often by one of the Maulanas in our community, Maulana Hasim Qasim, remind us often to say, for argument's sake, things like, the bigger the challenge, the bigger the reward. So, we believe that health and sickness come from Allah, and it's a test and it's a blessing. And that's really how we took it. I think life post-COVID is a very different thing. I think the appreciation of life, connection with my own family, as a family in the house, with our extended families, individuals, strangers, is, if I compare to life before COVID, I think there's a better connection, there's a better appreciation for each other. There's a lot of gratefulness, there's a lot more helpfulness, and especially helping those in need. What helped us tremendously in this house was that we had the immediate support structures in place, with my wife being the biggest support structure. And then obviously the extended families, the neighbors, even strangers that it would just pull us up and extend, a helping hand. I think the appreciation for the frontline workers as well. The team of Dr. Aziza Baldin and her daughter, Dr. Leila Biko. These are just ordinary people out there that really went the extra mile. I think sometimes those frontline workers, whether they are in healthcare or otherwise, it takes really something maybe like this, like a crisis, to realize not only the importance of what they do, but I think the real impact that they have on humans in general, in that service industry. I think the community at large and the religious leaders that's in our community, like Sheikh Ibrahim Kofa, and I mentioned Maulana Hasim Kasim, they would always, keep us in their du'as. In fact, in the community that we live in Kulutia and Cape Town, community has been reciting daily khatams since the start of, lockdown and COVID, and it's even continuing up until today. So I think all in all, Hawa, and I think for the listeners and the viewers, this experience of being COVID positive, being diagnosed, going through this experience, reflecting back on what could have happened. I mean, there are so many that we know of even today that are still contracting the virus because of the wave 2 coming in. I think the serious nature of this virus can not be, understated. Is something that really, it humbles you to the point where it's a leveler. Or, if ever you've been on Arafah, people speak about Arafah and Hajj is a leveler. I think this COVID experience again has, in my humble opinion, it has put that level or balance between the fact that it doesn't matter where you come from, what your position is in society, or the fact is that COVID can hit anyone.
Ridwan,
At any point.
sorry, if I could just come in there quickly. Sorry to break you. We do just have a minute or so left. I want to just get your gauge your thinking with regards to the second wave and even just the pandemic in general. Because at the end of the day, it takes you and I to make that change. There is no vaccine at the moment. They're working very hard at it. It's progressing. But to understand that you and I are the reasons the second wave is upon us. So what message do you have to those individuals? And speaking to, some specialists, and they know what's going on, but there are people out there that are still underestimating this pandemic. They are saying we don't see it. We don't know anybody that has died. We don't know of anybody being affected badly by it. There weren't any low moments. We're just being told by government to listen and do A, B, and C. So they are not doing the conventional pharmaceutical practices, wearing the mask, sanitizing them. People are actually refusing. There are some people with the thinking of not wanting to need to wear a mask. What is your opinion around that as a COVID-19 survivor?
Look, like I've said to you, in terms of contracting the virus, we have no idea how we got it. it could have been maybe that one point in time where we went outside, maybe touched something, came back, touched our face, our mouth, or we could have got it in that way. But, we've stopped speculating. I think the message, though, in terms of the virus, is it real? Is it not real? I've had quite a bit of illnesses over the years, quite a bit of different colds and flus because of the amount of travel that I did. I can tell you for one, this is not like any other flu. If you think it's a flu-like symptoms or cold, it is probably, I would say, 100 times more, depending on how severe you get it. And I think the amount of symptoms that goes with it, it's not your ordinary flu-like symptoms as well. So, prevention is better than cure. There's a lot of masjids now in Cape Town and all over that has voluntarily closed because of the second wave and the numbers going up. I think as an ordinary South African, ordinary layman out there, like many of us are, is that at the end of the day, we have a responsibility to our families, to our elders, to our community, and people that know who are those medical experts that you referred to earlier. None of us are that. These people have spent many years studying that particular science and so forth. So we need to take what they have seriously. I mean, if you don't want to believe the people giving you the messages over the media, speak to your local GPs, local doctors that you have access to get news, as I said, from the horse's mouth. And I think the warning out there, especially during this time, where we're heading into the summer season, we're going to have 6 weeks of, children at home. The beaches wants to be full in the Cape. We know what's happening in the Eastern Cape. We know that traveling between provinces are not sort of stopping. So I'm just hoping and I'm appealing to everybody is to please take caution.
Inshallah.
Family functions,
Inshallah.
all of that stuff. Take precaution. Prevention is better than cure.
Absolutely.
Like the old Cape Town saying, Muni gaan soek vir dit, man.
Yeah. Moenie krap vir dit, Jikkie. Ridwan Hassim, shukran so much to you. It was a perfect interview. I hardly had to ask you anything. We appreciate the story that you shared with us and hoping some of those that don't get it will actually get that message. Ridwan Hashim from Cape Town, shukran so much for your time. Our COVID-19 survivor on today's Blood Transfusion show. We'll talk more on that topic just after this. Welcome back. This is Health Matters and the show Blood Transfusion during this holiday season. And we want to highlight this topic because you need to become a blood donor. As we heard from the representative of the South African National Blood Service, and we know out in the Western Cape is the Western Province Blood Transfusion, make contact with these organizations and initiate that blood drive. As she said, take along a buddy and put the word out there. They are in critical need of your blood. So if you can donate, you're over 16, healthy, fit, see that you had a good meal, so your iron and your hemoglobin is not low when they do test the necessary. They go through a rigorous questionnaire and they absolutely make all the areas around the blood donation when you're sitting, when you're laying down, when you do the initial prick, safe for you. So it is safe during this time of pandemic. We now link up with a specialist physician out at Melomed Tokai in Cape Town. Dr. Sharok, thank you so much for your time.
Pleasure. Thank you for the invitation.
Welcome to ITV. A very important topic, and some of us has not become a blood donor just yet, but to understand hematology and the world of blood that's going through our bodies, Please do explain to us what is the different types of blood available. The representative from the SANBS has encouraged those with, I think it was a blood type O negative, predominantly to come forward, especially because it's a universal blood type. So take us through the different blood types and what that means.
Well, look, I'm not a representative of the blood bank, and I'm not the type of person that would now organize donor drives and donor motivations. But okay, just to have a short recap about what is actually blood. So blood has got several components. It's mainly red blood cells. We also call it packed cells. We've got white blood cells, and we've got platelets and plasma. So these are the major components of blood. So whole blood is hardly ever given to a patient. So it's always a component of this blood that will be given to the patient that is in need for either one or more of these blood products. So, for example, most of the blood products that we need or that patients need are what we call red cells or packed cells, which is concentrated red cells without platelets, without plasma, and preferably also without white blood cells, because white blood cells should actually never be given to a patient. So they usually get filtered, either through a filter that is given at the bedside, or they get filtered at the blood bank. So that is a product that we don't need.
Okay.
Then platelets are also important, especially in cases of patients that are bleeding due to low platelet count, which can either be due to either treatment related, for example, chemotherapy, or bone marrow failure due to acute leukemias, or perhaps in the trauma setting when there is a major mayhem in the circulation. We have also got clotting factors, which are in your plasma, which is, for example, given to patients that have got severe infection or also trauma complicated by clotting abnormalities. And then, but most importantly, we give red blood cells to patients that, for example, have been involved in a car accident, have lost a lot of blood, or have been stabbed, trauma usually, or also quite common obstetric complications, with other words, ladies that deliver a baby and exsanguinate, with other words, bleed almost to death. They also need red blood cells to revive their circulation.
So the blood group O, could you just elaborate on the different types of blood groups as well, if you could tell us about that, and what does blood O mean?
So blood groups, look, so blood groups is a technical aspect of blood transfusions, with other words, or platelet transfusions, or blood product transfusions in general. So before we give a blood product to a patient, we need to know what is the blood group of that patient. There are 4 major blood groups: blood group O, blood group A, blood group B, and blood group AB. So these are the major blood groups. Then we also have what we call rhesus groups, which is either rhesus positive or rhesus negative. So that is another type of blood group or blood type. So you have got O positive, O negative, A positive, A negative, B positive, B negative, AB positive, AB negative.
What
and then
makes...
there are also many other minor blood groups that we usually don't mention, but these are also important to look, especially for antibodies that might be present in the patient or against the donor. With other words, we always take a sample from the patient to test for these antibodies, so that we know that if we give a specific donor, that the patient should not have antibodies against that donor.
Why is blood group O so important or needed, as mentioned by the transfusion services, that it's a universal blood type? Why is that?
So it is the universal blood group because blood cells with blood group O don't have any abnormal, let's put it this way, antigenic proteins on their surface. With other words, the absence of any antigens on these red blood cells almost excludes antibodies against it. So with other words, if you give blood group O to the patient, there will be hardly ever a reaction against that donor, especially in emergency situations.
Okay, good. Let's understand the type of people that needs blood. You've mentioned the mothers that are giving birth. Some patients have a certain condition that they need regular blood transfusions. We are reaching the festive season where potentially more accidents are happening, where the hospitals are then inundated with people needing blood through those accidents. What other conditions need, or patients that need regular blood transfusions, and why those are one of the reasons why we should be donating blood?
Yeah, so the major group of patients that need blood products on a regular basis are the patients with bone marrow failure syndromes.
Okay.
So with other words, their bone marrow doesn't work, which is the factory of your blood. So they need blood every, say, 3 to 4 weeks for the rest of their lives. And that's why we need always a steady supply of blood donors, which fortunately we still can cope with, especially within the Western Cape.
Let's look at the donations that one does do at the different drives. I think you donate 1 or 2 bags of blood, and you've mentioned it's then transferred into various blood products to be given to those patients. How many patients are assisted or helped with one person's donation? Do you know?
Well, look, if you have a patient or a donor that gives, say, half a liter of blood in a donation, I mean, that is now a rough estimate.
Okay.
Now, of that half a liter, about half of that will be at least red blood cells, or perhaps a little bit less. So then we have got the remainder, mainly plasma. So that plasma can be used for another patient that needs plasma. So then you already have helped 2 patients. Then there is also a small component existing out of platelets, which can be also used towards another patient that needs platelets. But usually you need about 6 pooled donors to form 1 unit of platelets for a patient. So in summary, I mean, you can probably help 2 patients and a 6th, if you can say it like that.
Wow. Okay. So so minimum of 2 and as much as 6 patients. Wow, that's brilliant.
No, a 1/6.
Oh,
I mean,
1/6.
you need 6 pooled platelets to form 1 unit for 1 patient that needs platelets. So there's not enough platelets in 1 donor, in 1 donation that can help 1 patient. So you need 6 pooled donors to help 1 patient that needs platelets.
Platelets. All right. Let's understand the type of people that can donate blood. Who can donate and who cannot donate blood?
Yeah, so any young, healthy donor can give blood. So with other words, no chronic diseases like chronic kidney, chronic liver, chronic heart, chronic lung, no infectious diseases like HIV, hepatitis B, hepatitis C, syphilis, etc. So these units get all screened for these diseases. I mean, and that's why the blood is fairly safe. I mean, the chances of transmitting HIV disease is very small, less than 1 in a million donations. So, I mean, it's very safe from that point of view. So, and there's also a quarantine period in which the donated blood will be quarantined for a while, especially to make sure that we don't deal with an infection that pops up in a later stage. So there are quite a few ways and means to ensure the safety of a blood donation. So that will summarize that in this aspect.
All right. We talk more on blood transfusion and your donations just after this short break with specialist physician hematologist out at Melamed and Takai just after this. Stay with us. Welcome back to the world of blood. We're focusing on blood transfusion, your donation in this edition of Health Matters. Please note you can catch any of our shows that you have missed on ITV Health Matters YouTube channel, and you can watch us live as we're streaming currently on www.itvnetworks.tv. Click on live stream wherever you are over the beautiful mountains and the glorious seas. I'm Hawa Salman. Thank you so much for joining us. We've got about 10 minutes to wrap up as we speak to specialist physician out in Tokai, Cape Town, hematologist Dr. Shahrak, understanding the different blood types, how safe it is, and who can donate. And as much as possible, if you can, please go out there and donate. So, Dr. Shahrak, looking again at who's able to donate and who cannot. You've mentioned healthy, fit, able individuals, those with certain conditions cannot. What about ages? I know that the blood transfusion services mentioned something around you can start as young as 16, but can individuals who's been blood donors for years and years, up until the age of 60, 70, 80 even, maybe still donate blood?
Yes, certainly. Look, I don't know the official cutoff for the age group, so I'm not 100% aware of that. But in theory, any healthy donor that doesn't have any pre-existing conditions should be able to donate blood, whether he is now old or young. As long as he is fit and healthy, that is the most important.
Okay, just checking, because I know of a 73-year-old young woman that still donates blood. So that should be a good example to all of us.
Yes.
Let's look at the blood products and the cost involved in those blood products. What does that entail, Dr. Shahrak?
Yeah, so that explains obviously why blood is so precious. Blood is costly. I mean, we are dependent on the goodness and the willingness of healthy donors to donate. These blood products are not cheap. I mean, we are talking about thousands and thousands of rands. One of the most expensive products are the mega unit platelets, which are platelet donations by specific donors. So they only give platelets, no other blood products. And I mean, these platelets are more than 10,000 rand per bag. So you can split the bag and help 2 patients with it. But I mean, I would still reckon that these blood products are more than 5,000 to 10,000 rand per donation. So I mean, these are not cheap products. So we need to be very sparing with these products, and also there must be good and strong indications for these blood products to be administered and not just willy-nilly administered.
Okay, so quickly explain to me, because I had an experience, I think I was a couple of months pregnant. I haven't been for a blood donation in a while, so they were checking up on me and reminding me I needed to donate. I got a call to say they needed my blood platelets. I didn't actually understand what that meant. Of course, they explained I was pregnant.
They needed platelets.
Yes, they needed my platelets. They asked and called me to come and donate because they needed specifically my platelets. I think I'm A positive. But I just want to understand what was that? Could you explain that situation?
Yeah, so look, as I mentioned before, if a donor goes for donation, they usually take whole blood, of which you get a small component of platelets, which is not enough to help a patient with. You need 6 pooled platelets to help 1 patient. But we actually need also single donor platelets. We call that mega units of platelets.
Okay.
Especially for patients that need on a regular basis platelets. For example, the ones that I mentioned before with bone marrow failure syndrome. So there they sometimes approach donors for platelet donations only. So these are much fewer and far in between than, for example, the patient donors that give whole blood. So that's why they sometimes will approach you to only give platelets.
Okay. So understanding the possible complications that could occur during blood transfusion, are there any, and what should we know about that, the safety of possible complications around that?
Yeah, so look, as I mentioned previously, infections that is rather a small component. So, I mean, the chances of transmitting HIV disease or any other infections for that matter is rather small because we test every single unit for these infectious agents. So that is rather rare. But there are many other transfusion complications, like, for example, fluid overload, which is a problem, for example, in cardiac patients. So we need to be very careful with giving blood or platelets or plasma, for that matter, to patients that have cardiac conditions. So we need to do that very slow, and we need to do that very careful to avoid cardiac overload. You can cause transfusion-associated lung injury, which is fortunately very rare. I mean, it's probably only, say, 1 in 5,000 to 200,000 donations. So it's a rare condition, but if it happens, it can be fatal. You can have an allergic reaction to certain plasma products, which is also rare. I mean, all of these complications are rather rare, but not unheard of, and there are serious complications. So we need to be always very careful about this. So if we can avoid a transfusion, then we should always attempt to do other things besides a blood transfusion or a blood product transfusion.
Dr. Shahrak, is there a relationship between a certain blood group and one's diet?
No, I mean, this myth is debunked several times. There is no relationship between blood groups and diet. I mean, this diet and blood group relationship has been popularized by the media because diet and obesity is so strongly linked that people thought, okay, maybe if you go on a specific diet, if you have a certain blood group, then you will lose more or less weight. That is not true. It's a myth. And I hope that this myth will be debunked for the rest of our lives.
Great stuff. That is your specialist physician talking, hematologist, Dr. Shahrak. So let's debunk that myth. Your blood group and COVID-19. As we know, the pandemic is here. We hit the second wave. Let's talk about COVID-19 and those being affected or infected rather, and the various blood groups, and also possible donors that have had COVID-19.
Yeah, so the easier one is obviously donors that have COVID. I mean, if you have, as a donor, active COVID disease, then obviously there is no reason why you should donate blood. I mean, everyone that is sick with symptomatic COVID disease shouldn't donate at all. That is fairly straightforward. But sometimes, I mean, in 40 to 50% of the donors, they might be asymptomatic and only be discovered later that they have COVID. But as COVID is a respiratory disease, there's only very little chance that the COVID will now be detected in your blood. So it's not a major issue. So that is for the donation of COVID positive donors. Then you have the issue of blood group and the relationship to the susceptibility to COVID disease. Some blood groups may indeed have a slightly higher chance of contracting COVID disease. And especially blood group A has been linked to that. But the risk is not so high to make now a huge fuss about it. I mean, I think it's much more important to just adhere to the normal measures that should be taken to avoid contracting COVID disease. But even more importantly is that if you have high risk for severe COVID disease, like, for example, obesity, diabetes, hypertension, chronic kidney disease, then it's very important to try to avoid contracting COVID disease, or the coronavirus, SARS coronavirus 2, which is by far more important than the blood groups.
Dr. Shahrak, unfortunately, that's where we have to leave it. Thank you so much for your time. We appreciate your expertise and wish you well during this festive season. Please do keep safe, and we'll chat again. All the best and goodbye.
Thank you very much, and keep you healthy too.
Thanks. Dr. Shekrak, specialist physician, hematologist out in Tokai, Melamed in Cape Town. Be safe, be a blood donor, grab a buddy, initiate a blood drive in your community, your nearest school, mosque, community centers, and do keep that social distance. And if you've got a blood O, I think it's O negative type, please do find out what your blood group is. They are in desperate need of your blood. From myself, Hawa Solomon, and the rest of our team here in Johannesburg, be safe, wassalamu alaikum, and goodbye for now.